Good morning. Welcome to London Health Sciences Centre's media conference to address the ongoing COVID-19 outbreak at University Hospital. I'm Merrick Kubo, a communications consultant in corporate communications and public relations. I will be moderating the media conference today, which will end by noon. I'd first like to introduce our spokespersons, Dr. Paul Woods, President and CEO, Dr. Adam Duklow, Chief Medical Officer, and Dr. Michael Payne, Medical Director, Infection Prevention and Control. Thank you for your time today. Given the short amount of time, we ask that questions be reserved for media who are on the WebEx event only. We will be using the Q&A function in the bottom right corner of your screen, and I will read your questions to our spokespersons. Please address your questions to myself, Merrick Kubo, via the Q&A function. If you write a question directly to a speaker, it may not be read. I will direct questions to a specific individual, but I welcome all of our speakers to elaborate on an answer if they wish. With that, we will begin with brief remarks from Dr. Woods, followed by Dr. Duklow, and then Dr. Payne. Dr. Woods.
Thank you, Merrick, and good morning. Let me start by sharing with you today's University Hospital outbreak associated numbers. These are running totals. There have been 48 staff and physicians have tested positive with COVID-19 associated with this outbreak, and 64 patients have been tested positive with COVID-19. And regrettably, this number includes 12 deaths. I want to begin by acknowledging the human tragedy of this pandemic, and specifically this outbreak. 12 people have died as a result of the COVID-19 outbreak at University Hospital. I know I speak on behalf of everyone at LHSC when I offer our sincere condolences to the families. We're doing everything within our power to keep this number from growing. But trying to keep a pandemic out of a hospital is a challenge. Now that it's here, getting it out is even more difficult. COVID-19 has proven to be a highly infectious virus that spreads very quickly. I know there's been a great deal of recent speculation that a potluck was the source of the outbreak. We have thoroughly investigated this claim, and there was no potluck that contributed to the outbreaks at University Hospital. That being said, we agree with the health unit findings that there were breaches in PPE use during breaks, and physical distancing was not always maintained. I want to emphasize that I'm not assigning blame. Our staff and physicians have been vigilant and dedicated in their provision of safe patient care since day one of this pandemic. But we are human, we are fallible, and we are tired. While regrettable, I can say with certainty there was never a breach intended to cause harm. That's not who LHSC's people are. LHSC continues to partner with the Middlesex London Health Unit to implement measures as part of our tiered outbreak response that are aimed at limiting transmission. Certainly, these escalating measures are having impacts to patients who have been waiting for appointments, procedures, and surgeries. I regret these cancellations, and we're working around the clock to ensure that we can resume our regular operations at UH and continue to offer the safe, high-quality care our patients depend on and expect. I want to take this opportunity to thank every individual at London Health Sciences Centre for their tireless efforts through the pandemic, and especially over the past 3 weeks while we collectively work to limit the spread of COVID-19. This pandemic is a historic human tragedy, and I recognize its toll will be felt for a long time to come. Lastly, despite our fatigue, we want our patients, their loved ones, and our community to have trust and faith that our hospitals are safe. LHSC will continue to do everything it can to address this outbreak while remaining open and transparent about measures and actions being taken. I will now turn it over to Dr. Adam Duklow, LHSC's Chief Medical Officer.
Thank you very much, Dr. Woods, and thank you to all of you for joining us today. I've had the privilege of speaking to many of you over this past week, and as Dr. Woods just noted, LHSC remains committed to remaining transparent about this outbreak and its associated impacts on our patients, providers, and community. As such, I will continue to join some of the health unit media briefings, including this coming Monday. I echo Dr. Woods' sentiments that we truly regret the impacts our outbreak measures are having on patient appointments and procedures. The implementation of these service changes was not taken lightly, but was felt to be a critical next step in containing our outbreak. I have just come off a shift in the Victoria Hospital Emergency Department that started in the middle of last night. I can tell you with 100% confidence that our staff and physicians are working tirelessly to ensure every patient who needs us receives safe care. That being said, ambulatory care volumes were reduced and surgical capacity is at approximately 25% of the normal for University Hospital. We continue to provide urgent and emergency surgical and ambulatory care. which means that anyone requiring care within 7 days as determined by their healthcare provider will continue to receive it. I want to stress that all surgical and ambulatory care at Victoria Hospital is operating in full capacity. As an emergency physician, I must also emphasize the critical message that please do not delay your care if your needs are urgent. We can care for you safely, and your immediate care needs will be met. Thank you. I now have the pleasure of turning it over to my colleague, Dr. Michael Payne, LHSC's Medical Director of Infection Prevention and Control. As you can imagine, he has been a huge resource and an excellent physician to work with throughout this entire pandemic. Over to you, Mike.
Sorry, Dr. Payne, you are muted.
My apologies. Sorry. Thank you, Dr. Duklow and Dr. Woods. Thank you for providing your updates on the outbreak so far. I'm here to provide further information of our current management of the University Hospital outbreak. Next slide. It's with a heavy heart that I give an update of the current status of staff and patient cases here at LHSC. We have had 48 staff affected, as well as 64 patients, and regrettably 12 deaths. My thoughts and prayers are with the staff and patients, as well as their families affected by this outbreak at this time. Below is a chart of the cases that have occurred in University Hospital over time. The outbreak was declared on the 10th. Routine outbreak practices were put in place. Unfortunately, approximately around November 22nd, we had a large spike in cases increase. And around those times, enhanced outbreak measures were put in place in partnership with the Middlesex London Health Unit. And we've had continued transmission to other areas in our hospital that have required a downgrading of services within our facility in order to protect our patients. So just next slide, please. This is just a graph of our patients affected by age and gender. And so unfortunately, being our hospital, we have many vulnerable populations in our hospital, and some of our elderly patients have been affected by this outbreak, and my thoughts are with them. Next slide. This is just the timeline of our outbreak response. So we declared our outbreak on November 10th. We put in place our routine outbreak measures in partnership with our Middlesex London Health Unit, as well as conducting prevalence screening of patients and staff, which is routine. We also initiated our incident management team. Along further management on the 17th, we conducted further prevalence screening and identified 4 additional cases. At this point, we moved to masking of all inpatients in our facility. And then on further testing on the 22nd, we subsequently identified 8 more cases. At this point, we worked with the Middlesex London Health Unit to implement a staff quarantine program, as well as cohorting our staff strictly to the outbreak units. We extended the outbreak to all our connected medicine units at University Hospital, and all admissions to any medicine unit in the facility were discontinued at this point. Next slide. We also, at this point, initiated testing of all current inpatients that were at University Hospital, and we extended masking to all inpatients in our facility. We also had exposures and extension of the outbreak to the transplant unit and our cardiac surgery unit at this point. And again, in partnership from the 27th to the 1st, we also implemented many more control policies here at the facility, such as restriction of visitors, testing all the staff who work in our facility at University Hospital, and all patients on admission to University Hospital. We also work to limit staff movement between University Hospital and Victoria Hospital, as well as providing instructions to our staff members, in addition to quarantine, to limiting community social interactions. This was in part with the Middlesex London Health Unit. At this point, we did reduce scheduled procedures to urgent and emergent only. Those patients who are required within 7 days, as Dr. Duklow mentioned, would receive them, but we did downgrade elective procedures at this time. We continue to audit our outbreak measures during this period, and as well, we had to extend reduction services to our ambulatory care as well. Next slide. So to address the question of why this happened, unfortunately, outbreaks are multifactorial in nature. There's many factors that can contribute to transmission, such as personal protective equipment, hand hygiene, cleaning of hands and equipment, physical distancing, and patient placement. And unfortunately, COVID-19 is a challenging virus. It can cause outbreaks, particularly for units that are highly connected, as well as our most vulnerable patient populations. In response to this, LHSC has implemented multifactorial interventions to interrupt transmission and to prevent this from reoccurring in the future. Next slide. So in summary, we've had a large outbreak related to the medicine services here at UH, requiring extensive control measures in partnership with the health unit. We've implemented extensive staff and patient testing, patient masking, work quarantine and staff cohorting has also been implemented, and we've had to limit our services to urgent emergency only at the university campus. This severe disruption to our services will likely persist through the month of December at University Hospital. And I also at this point want to thank all of our team members at LHSC, the physicians and staff, for their incredible work during this period. Our staff worked tirelessly to care for our patients, and I want to commend them for their work on the front lines, and I know this is a very trying and tiring experience for them. I also want to give my thoughts and prayers to the patients and families who are affected by this outbreak currently. Next slide. Any questions?
Thank you, Dr. Payne. So I'll begin. We have a few media questions from various outlets. I'll begin sharing them with you. And the first question will go to Dr. Duklow. He's answered this already this week. Will LHSC commit to a formal review of the outbreak and its contributing factors by internal audit or third party, with recommendations to enhance the hospital's outbreak management and IPAC protocols? If so, will it make the report public? Dr. Duklow.
Thanks very much, Merrick. So as Dr. Woods indicated at the beginning of this press conference, we have completed the investigation into the suggestion there'd been a potluck. We've also continued a contact trace right back to the beginning of the outbreak. So we are in the midst of an ongoing investigation and making changes as we go that Dr. Payne just outlined. So I think we're definitely committed to investigating the outbreak and have been doing that for some time now. At this point in time, we don't see a need for a third party investigation of the outbreak, but we're always open to ensuring that we contain this outbreak and learn from it.
Thank you. Dr. Woods, this question is for you. Multiple media outlets have been reporting that there was a potluck lunch at University Hospital. Can anyone confirm that this happened? I know that you've answered it, but I'd like you to answer it again.
Sure. Yeah, we have conducted a thorough investigation, and there is no evidence that a potluck occurred leading to this outbreak, and so that I'm confident that there was not a potluck.
Thank you. Another question for you, Dr. Woods, and it comes from Jen Beeman. Is this the largest or deadliest hospital outbreak in Ontario?
So I don't know how to answer that, Jen, because there is not a sort of a database where we share the size of the outbreaks. We know there have been multiple other significant hospital outbreaks. It has been my impression that there is at least one other larger that has occurred, but I can't comment on any specifics, but it is my belief that it is not the largest.
Thank you. Dr. Payne, Denise Paglino-Juan has a question for you. Would you be able to specify how many of the deaths are patients and how many are staff?
As far as the current deaths that have occurred, the deaths that are related to this outbreak have occurred in patients.
Thank you. And a follow-up question from Jen Beeman. Are the 12 deaths included in the 64 patients who have tested positive?
Yes, the current patients who have passed away are included in the current case numbers.
Just an awkward pause by me. Another question from Jen Beeman. I think you've addressed this, Dr. Payne. What measures to contain the spread of COVID-19 did LHSC put into place? That was part of your presentation. Why those measures, when you put them in place on November 10th, how did the outbreak spread further?
So COVID-19 is a very challenging virus that can spread quickly through connected units as well as vulnerable populations. Even through the best efforts, COVID-19 still can be transmitted and patients exposed go on to develop symptoms. So unfortunately, we put in all of our measures immediately at the start of an outbreak. Unfortunately, COVID-19, there sometimes is continued transmission that occurs.
Thank you. Dr. Duklow, a question from Denise. Have there been any updates to any services being temporarily suspended as of today?
There's been no changes to services on the whole being temporarily suspended as of today. Last Friday was the first day that we had ramped down some of the surgical and procedural services, and there's an ambulatory care ramp down that occurred 3 days ago on Tuesday, but no significant changes made today.
Thank you. Dr. Woods, is LHSC concerned about the potential legal exposure 12 outbreak-linked deaths could bring from those patients' families? And this is from Jen Beeman.
Yeah, Jen, that's not something that I think is really foremost in our mind. I think we're completely sort of absorbed with how we're actually going to bring this outbreak to a close. And, there will be all kinds of discussions afterwards about a number of things. And that certainly is possible that that's something that's going to come up. But really, all our efforts right now are focused on bringing this outbreak to a close and to preserving the health of our patients and our staff and the community.
Thank you. And another question for you, Dr. Woods, from Daryl Newcomb. Given 12 people have died, will there be consequences to those ultimately found responsible, either staff or administration?
So if there was sort of determined as a result of investigation to be willful acts that had been intentional in terms of bringing about harm to patient, then there are human resources policies and procedures, and there are consequences associated with that. I would say unless that happens, that we don't really talk about punishment for instance, a mistake. That would not be in play, but we will certainly investigate all potential sort of theories, which I believe that we have already done. I'm confident that the potluck theory has been put to rest.
And Dr. Payne, can you just clarify on the results of the investigation?
Sorry, to clarify for the results of the potluck investigation, sorry?
What the cause of the outbreak is.
So outbreaks are multifactorial in nature. That's the nature of outbreaks with infectious diseases. We've identified many potential contributors to the spread of this outbreak in our facility and have addressed those through partnership with the Middlesex London Health Unit and our staff.
This question comes from Jane Sims. Earlier in the pandemic, there were outbreaks on other floors in London. However, there wasn't widespread of the virus or large numbers of fatalities. What was the difference between what happened on those floors to what has happened at UH?
So again, yes, we have had previous outbreaks here at LHSC, and we manage our outbreaks with routine practices that we put in place in partnership with the Middlesex London Health Unit. Again, every outbreak has multiple causes, and this one is no different. We have identified any potential causes that could have led to an increased case number that we've seen in this particular outbreak, and we've put in place measures to address those potential causes.
Thank you. A question from Sawyer. Are there concerns that fears of being reprimanded may dissuade staff from being honest with those investigating the UH outbreaks? I think this is a question for Dr. Woods.
We've worked really hard at LHSC over the past number of years to bring in a culture of safety an accountability where everybody in the organization is held to that same level of accountability, starting, at the front line and support services all the way up to myself. And so I know that that's been a question, is do people feel safe? We are also instituting something called Just Culture, which is something that really creates a different sort of level of safety and also accountability within the staff. So I hope that's not the case. I would say that we've been very intentional as an organization, really from the executive leadership team all the way down to the front line, about creating safety. And that would certainly be distressing if, in fact, people did feel that there was fear of retaliation or retribution, and that would be something that wouldn't be acceptable to the organization from my perspective.
Thank you. And I do have a follow-up question for you, but as they've come in, it's moved me down a little. Were there complaints before the UH outbreak from staff concerning a lack of safe break space and a shortage of PPE? Did this contribute to the outbreak?
So the shortage of PPE was essentially a wave one phenomenon. We're still being very careful about stewarding some of the higher level personal protective equipment for very specific indications. We're confident that in terms of the impact of PPE on this outbreak, it was adherence to what recommended PPE was, as opposed to lack of availability of it. In terms of complaint about break space, it's something that we have heard, and our facilities team has put it as the #1 priority, is to identify and maintain safe break space. Unfortunately, hospitals, University Hospital is a very old hospital, and none of these hospitals were built contemplating the impact of a global pandemic with a highly infectious respiratory virus, and what kind of resources we'd have to have. So given the scope and the danger of this virus, we have identified break spaces, and we have the maximum number of people that can inhabit or can collect in those particular break spaces. But it's definitely a problem because we don't have enough square footage to do it. So people are going to, or have had to, sort of stagger break times and that sort of thing.
Thank you. A couple questions for Dr. Payne. One from Sawyer. Have we turned the corner, and will we start to see a decrease in 2 weeks' time? Or is this still the beginning of the outbreak?
We've implemented many outbreak measures within our facility. We're hopeful that indeed that over the coming 2 weeks, we'll see reduction in cases and the ending of this outbreak.
And this is either for yourself, Dr. Payne, or for Dr. Woods. Have any students who are on placements at UH tested positive?
I'll hand that one to Dr. Payne. I don't know the answer to that.
I would address that answer to the university if they wanted to comment on that.
Thank you. And that came from Sawyer, or Skylar, I'm sorry. A question from Daryl from CTV. Given the outbreak began on November 10th, and there have been at least 24 secondary cases caused in the wider community, should the hospital have done a better job providing timely information to the general public? And this is addressed to Dr. Woods.
Yeah, so one of the commitments that we have had as a leadership team representing the hospital has been transparent and timely communication, and I would say it's a challenge to understand what it is we should communicate and when we should communicate it and how we should communicate it. And we have had a communication team who has been 24/7 on this outbreak since the very beginning, since back in March. And so while I'm pleased with the communication that we've had, I think it's possible we could always look and say, well, maybe we should have done something different. That's always one of the things when the dust finally settles after a real catastrophe event like what we're dealing with as a society and as a global community right now is to look back and say, what can we do better and what should we have done different? So it's premature for me to comment on that. We would certainly look at our communications and say, should we or could we have done anything different? But we have been compliant with the requirements of the Middlesex London Health Unit, who I think has done a great job of communicating all the activities. And so as far as I know, I think we're doing, I think we did everything that we were required to do and should have done.
Thank you. And a question for Dr. Duklow. Can you confirm that hospital admissions are still ongoing for other services like emergency care? This comes from Denise, but Adam, I wonder if you could talk about both surgical, ambulatory, and give a picture of what our services look like.
Thanks very much, Merrick. It's a really good question. So the emergency department at University Hospital is fully open and safe. Patients that present to the ED at UH that need to be admitted to a medical ward, so for instance, someone with a pneumonia or a medical type problem is, once the admission is determined to be necessary, are transferred to Victoria Hospital to the ward. So that's why we've added beds at Victoria Hospital for medicine admissions, and that's due to the outbreak being on the medical wards at University Hospital. Surgical admissions continue to happen through the emergency department at University Hospital. Similarly, patients that are having urgent and emergent surgery, such as cardiac surgery, are admitted from the operating room and post-anesthetic care unit to the ward at University Hospital. The ambulatory care clinics are still operating and seeing people that are deemed to need to be seen within 7 days in an effort to maintain or improve their health.
Thank you. Question for Dr. Payne from Jennifer Beeman. Are all the deaths lab confirmed COVID-19 cases or epidemiologically linked to the outbreak?
All cases reported are confirmed by our laboratory by testing.
And a follow-up question for you, Dr. Payne from Sawyer. Have staff from other LHSC hospitals recently tested positive for coronavirus? If so, are any of those infections tied to the university hospital outbreaks?
So we have staff across the city who are members of the community as well. We are an organization of more than 10,000 people. Other staff have tested positive within the city, and that's normally expected, but there's no current outbreaks at Victoria Hospital linked to University Hospital.
Thank you. And a question from Dr. Duklow from Jennifer Beeman. Are transplant surgeries still taking place? Is LHSC coordinating with other transplant units in the province to handle some of these patients?
Thanks, Merrick. Transplants are still taking place. For a period of time, we were not admitting patients to our transplant unit after their surgery. We care for them in the intensive care unit at University Hospital to make that happen. We are just getting into coordinating with other hospitals within our region and across the province for all types of care in preparation that the outbreak at UH could last longer. We want to be proactive about that planning. Merrick, I did want to take a second to clarify the question, Jen Beeman's question around the 12 deaths. I think she was asking if the 12 deaths we're reporting are all related to the outbreak, or is it the 12 deaths inclusive of outbreak and non-outbreak related deaths? And my understanding is the 12 deaths we're reporting are outbreak related. There are additional deaths that have occurred that were not related to the outbreak.
Thank you. Jennifer Beeman asks, we heard representatives from the Ministry of Labor were on site at LHSC on Thursday. Is this at all in relation to the outbreak at University Hospital? Would Dr. Woods, Duklow, or Michael Payne care to comment?
So I'm aware that the Ministry of Labor has been on site at University Hospital. I think Adam is probably more able to comment on what day it was, maybe, and also what the nature of that inspection was.
Thanks, Paul. I actually do not know if it was related to the outbreak or not. I can say that we have the Ministry of Labor visit us as partners, not infrequently, obviously not every day, but we can confirm afterwards if any recent visits were related to the outbreak or not.
Thank you. Are there any other questions for media? I believe I have read them all, or if I've missed your question, now would be a good opportunity to read it or resubmit it. And we'll just take a moment to allow that to happen. Follow-up question from Sawyer. You said no other hospital outbreaks are connected to this one, but are other cases in other hospitals linked to this outbreak? Perhaps that's a question for Dr. Payne.
As far as I'm aware, I'm not aware of any cases in other hospitals outside of LHSC linked to this outbreak.
Thank you. Any further questions from our media? Thank you from Jennifer Beeman for setting this up, and I'd also like to express my thank you to all of you for being here. I see a question from Sawyer that says outside of LHSC or outside of University Hospital. I think that goes back to are there patients, are there cases in other hospitals linked to this outbreak?
Mm-hmm.
I think you've answered that.
Mm-hmm.
In that case, it is 10 to 12, and I think we will end this media conference. I'd again like to thank our speakers. I'd like to thank our media for coming and anyone who is watching. And we will be sharing more information as it becomes available. Thank you.
Thanks, Merrick.
Thank you.